I'm Tamara McCall. I'm an emergency physician at St. Boniface Hospital. I'm of Ukrainian background. And while I was born and educated in Canada, I've been involved in the Canadian community since I was a child. So I felt that I had a moral obligation to provide whatever assistance I could. CMAT is the Canadian Medical Assistance Teams. It's a Canadian nonprofit disaster relief organization. They've deployed to many disaster zones, but their target is typically areas that have been affected by natural disasters. This is actually the first war mission that they've been involved in. There's just been a flood of millions of displaced Ukrainians into Western Ukraine as they've escaped constant shelling and threat of death. Our team's been treating a broad range of medical cases, ranging from pediatric medicine to wound infections, either directly from the war or from IV drug use, which is actually quite rampant in eastern regions. We've seen shrapnel injuries and other trauma, a lot of chronic medical issues that have unfortunately gone untreated because of lack of access to medications and physicians. And then, of course, the very serious psychological impacts of the war. So anxiety, PTSD, adjustment disorders, and other issues have sort of been the most challenging and have certainly weighed quite heavily on our team. She was hiding in a Kharkiv train station in the basement as the shelling was going around her, and she was there with multiple other families. And part of the basement ceiling was starting to cave in. And so they were all running to the other side. And this woman's 67 years old. Her son is yelling at her to jump. And so she did and twisted her knee in the process. And something so simple as providing some analgesia and putting her in a brace and setting her up with follow-up with a hospital nearby to get an MRI of her knee turned into a counseling session because in addition to all that, she's having night terrors and waking up at night, unable to get back to sleep, but also screaming in her sleep, which has been keeping her entire family up. The Ukrainian spirit truly remains unbroken, and morale is surprisingly still quite high. And the country has really united around this common enemy. And I think a big part of that is sort of the leadership from the government for sure, but the outpouring of support from the entire world, really. So please consider donating either your time, money, or medical supplies to CMAT or any other reputable medical relief organizations. And please help administer medical assistance to those displaced and coming to Manitoba. Please sign up with Doctors Manitoba to take on our Ukrainian patients. Slava Ukraini.